If you've been recently diagnosed with diabetes, there are several reasons to consider yourself fortunate, despite the challenges the condition presents. Early detection gives you a significant advantage in managing your health. Here's why. You have time to act and prevent complications. Almost 1 in 2 adults with diabetes were unaware of their diabetes status. That is 240 million. The highest proportions of undiagnosed diabetes were found in the Africa and Southeast Asia regions. Many people with diabetes don't know they have it until serious problems develop. But you're aware of your condition early, which means you can take steps to avoid or delay complications like heart attacks, strokes, kidney disease, and vision problems. You can start making lifestyle changes immediately. With an early diagnosis, you can begin adjusting your diet, increasing physical activity, and managing stress right away. These changes can have a profound impact on your long-term health. You can work with your healthcare team to create an effective management plan. Early diagnosis allows you to partner with your doctor to develop a tailored approach to controlling your blood sugar levels. This might include medication, weight management, and lifestyle modifications. You have the opportunity to learn about your condition. Understanding diabetes is crucial for effective self-management. You can educate yourself about blood sugar monitoring, proper nutrition, and the importance of regular checkups. You can prevent or delay the progression of prediabetes. If you've been diagnosed with prediabetes, you have a chance to prevent or delay the onset of type 2 diabetes through lifestyle changes. You can start regular screening for diabetes-related complications. Early diagnosis means you can begin routine screenings for issues like diabetic retinopathy, nephropathy, and neuropathy. Catching these problems early greatly improves treatment outcomes. You can take steps to protect your cardiovascular health. Diabetes significantly increases the risk of heart disease and stroke. But knowing you have diabetes allows you to work on controlling other risk factors like high blood pressure and cholesterol. You can preserve your kidney function. Diabetes can damage the kidneys over time. Early diagnosis and proper management can help protect your kidney function and potentially avoid serious issues like kidney failure. You have time to establish good habits. Managing diabetes is largely about consistent, healthy habits. An early diagnosis gives you the chance to develop these habits before complications set in. Today, we'll address some common questions and provide clear, simple answers to help you better understand this condition. Let's dive right in. What exactly is diabetes? Diabetes is a condition where your body has trouble managing blood sugar levels. Normally, your body uses insulin, which is a hormone produced in the body. It helps cells absorb sugar from your blood. But in diabetes, either your body doesn't make enough insulin or can't use it effectively. This leads to high blood sugar levels, which can cause various health problems if left untreated. Are there different types of diabetes? Yes, there are mainly 2 types. Type 1 diabetes is when your body doesn't produce insulin at all. It's usually diagnosed in children and young adults. Type 2 diabetes is more common. In this type, your body doesn't use insulin efficiently or does not produce enough insulin for the amount of carbohydrates you eat. It often develops later in life, but we're seeing more cases in younger people too. What are the main symptoms of diabetes? Common symptoms include feeling very thirsty, urinating more often than usual, especially at night, feeling tired, losing weight without trying, and blurry vision. But remember, some people might not have noticeable symptoms, especially in the early stages of type 2 diabetes. Can diabetes be cured? Currently, there's no cure for diabetes, but research is ongoing for things like stem cell treatments for diabetes. But don't worry, it can be managed effectively with proper treatment and lifestyle changes. People like Bob Cruz lived with diabetes for more than 70 years till the age of 90+ years. Many people with diabetes lead full, healthy lives by keeping their blood sugar levels under control. How is diabetes managed? Management depends on the type of diabetes and can include different types of medications, regular blood sugar monitoring, healthy eating, and regular exercise. Lots of new medications have been approved for the management of type 2 diabetes since I was diagnosed 40 years ago. They are much more effective, safe, and easy to take. For type 2 diabetes, lifestyle changes like losing weight if you're overweight can make a big difference. The key is working closely with your healthcare team to find the best approach for you. Is diabetes hereditary? There is a genetic component to diabetes, but it's not the whole story. If you have a family history of diabetes, you might be at higher risk. But lifestyle factors like diet, exercise, and weight also play a big role, especially in type 2 diabetes. So even if diabetes runs in your family, you can take steps to reduce your risk. Can I eat sweets if I have diabetes? This is a common concern. You don't have to completely avoid sugar, but you do need to be mindful of your overall carbohydrate intake. Sugar is a type of carb, and all carbs affect blood sugar levels. It's about balance and moderation. Your dietitian can help you create a meal plan that includes some of your favorite treats while keeping your blood sugar in check. How often should I check my blood sugar? The frequency of blood sugar checks varies from person to person. It depends on your type of diabetes, your treatment plan, and how well your diabetes is controlled. Some people might need to check several times a day, while others might check less often. Your doctor will give you specific guidelines based on your individual needs. Can diabetes affect my eyes? Yes, diabetes can affect your eyes. High blood sugar levels can damage the blood vessels in your retina, leading to a condition called diabetic retinopathy. But regular eye exams can catch problems early when they're most treatable. That's why it's crucial to have your eyes checked regularly if you have diabetes. Is it safe to exercise with diabetes? Absolutely. Exercise is actually really beneficial for managing diabetes. It helps lower blood sugar levels and improves insulin sensitivity. But if you're just starting an exercise program, talk to your doctor first. They can advise you on any precautions you might need to take, like checking your blood sugar before and after exercise. Can stress affect my diabetes? Yes, stress can affect your blood sugar levels. When you're stressed, your body releases hormones that can cause your blood sugar to rise. But don't stress about stress. Learning stress management techniques like deep breathing, meditation, or yoga can help. Regular exercise is also a great stress buster. What's the deal with the A1C test? The A1C test is a blood test that gives you a picture of your average blood sugar levels over the past 2 to 3 months. It's like a report card for how well you're managing your diabetes. Your doctor will usually check your A1C every 3 to 6 months. The goal for most adults with diabetes is an A1C below 7%, but your target might be different based on your individual circumstances. Can I drink alcohol if I have diabetes? Alcohol can be tricky with diabetes. It can cause your blood sugar to drop, especially if you drink on an empty stomach. But if you choose to drink, do so in moderation. That means no more than 1 drink per day for women and 2 for men. Always drink with food, and check your blood sugar before, during, and after drinking. What should I do if my blood sugar gets too low? Low blood sugar, or hypoglycemia, can be dangerous. If you feel shaky, sweaty, or confused, check your blood sugar right away. If it's below 70 mg per deciliter, follow the 15-15 rule. Eat 15 grams of fast-acting carbs, like glucose tablets or fruit juice. Wait 15 minutes, then check again. If it's still low, repeat. Once your blood sugar is back to normal, eat a small snack if your next meal is more than an hour away. Can diabetes affect my feet? Yes, diabetes can affect your feet in several ways. It can cause nerve damage, leading to numbness, and it can reduce blood flow to your feet. This makes it harder for cuts or sores to heal. But you can protect your feet by checking them daily for cuts or sores, wearing comfortable shoes, and never going barefoot. Regular foot exams by your doctor are also important. Is it possible to reverse type 2 diabetes? Recent research has shown that some people with type 2 diabetes can achieve remission, which means their blood sugar levels return to normal without medication. This usually involves significant weight loss and lifestyle changes. But it's not possible for everyone, and even if you achieve remission, you'll need to continue a healthy lifestyle and regular checkups to maintain it. How does diabetes affect pregnancy? Diabetes can make pregnancy more complicated, but with proper care, many women with diabetes have healthy pregnancies and babies. If you have diabetes and are planning to get pregnant, it's important to work closely with your healthcare team before and during pregnancy to keep your blood sugar well controlled. Can children get type 2 diabetes? Traditionally, type 2 diabetes was seen as an adult disease. But in recent years, we're seeing more cases in children and teens. This is largely due to the rise in childhood obesity. Encouraging healthy eating habits and regular physical activity in children can help prevent type 2 diabetes. How does fiber affect blood sugar? Fiber is your friend when you have diabetes. It slows down the absorption of sugar, which helps prevent spikes in blood sugar levels. But remember, while fiber is a type of carbohydrate, it doesn't raise blood sugar levels. Aim to include plenty of high-fiber foods in your diet, like vegetables, fruits, whole grains, and legumes. What other organs and health conditions can be caused by diabetes? Diabetes can affect multiple organs and systems in the body, potentially leading to various health conditions. Here are some of the key organs and health conditions that can be impacted by diabetes. Heart and blood vessels. Diabetes significantly increases the risk of cardiovascular problems, including coronary artery disease, heart attack, stroke, high blood pressure. Kidneys. Diabetes can damage the kidney's filtering system, potentially leading to kidney disease, nephropathy, kidney failure. Eyes. High blood sugar levels can damage blood vessels in the eyes, causing diabetic retinopathy, cataracts, glaucoma, potential blindness. Nerves. Diabetes can cause nerve damage, neuropathy, affecting peripheral nerves, especially in feet and hands. Digestive system, urinary tract, blood vessels. Skin. Diabetes increases the risk of various skin conditions, including bacterial and fungal infections, slow healing wounds. Feet. Due to nerve damage and reduced blood flow, diabetes can cause foot ulcers, infections. In severe cases, amputations. Digestive system. Diabetes can lead to Gastroparesis, delayed stomach emptying. Other digestive issues. Sexual health, diabetes can cause erectile dysfunction in men, vaginal dryness and decreased libido in women. Hearing, diabetes is associated with an increased risk of hearing impairment. Brain, diabetes may increase the risk of Alzheimer's disease. Other forms of dementia. Oral health, people with diabetes are more prone to gum disease, tooth decay. Liver, diabetes is associated with an increased risk of non-alcoholic fatty liver disease. Liver fibrosis. Musculoskeletal system, diabetes can lead to limited joint mobility, frozen shoulder, Dupuytren's contracture, trigger finger, carpal tunnel syndrome. Mental health, diabetes is associated with an increased risk of depression and anxiety. It's important to note that while diabetes can increase the risk of these conditions, proper management of blood sugar levels, regular checkups, and a healthy lifestyle can significantly reduce the likelihood of developing these complications. Working closely with healthcare providers is crucial for preventing and managing diabetes-related health issues. Do not forget to click the like button and subscribe. Up above you see a few videos related to some other herbs important for diabetes and health.